Transcranial magnetic stimulation, TMS, is a non-invasive brain stimulation technique that uses electromagnetic pulses to modulate the activity of specific regions of the brain. It involves the application of a magnetic field to the skull, which induces electrical currents in the underlying brain tissue. These currents can selectively activate or inhibit the neurons in the targeted brain area, leading to the changes in brain activity and function. TMS is based on the principle of electromagnetic induction. When a brief, high-intensity magnetic pulse is delivered to the skull, it generates a rapidly changing magnetic field that penetrates the skull and induces electrical currents in the underlying neural tissue. These induced currents can depolarize or hyperpolarize neurons depending on the parameters of the stimulation. TMS is a versatile technique with various applications in both research and clinical settings. It has been used to investigate brain function, study the neural mechanisms underlying cognitive processes, and explore the potential therapeutic applications in neurological and psychiatric disorders such as depression, schizophrenia, and chronic pain. TMS is generally considered safe, but it is important to be administered under the supervision of trained professionals to ensure proper targeting and minimize potential risks. TMS can be applied in different ways, depending on the specific research or clinical objective. Single-pulse TMS. In single-pulse TMS, a single magnetic pulse is delivered to the targeted brain area. It is commonly used to map the functional connectivity of the brain, assess the integrity of the corticospinal pathway, or study the effects of acute stimulation on cognitive or motor processes. Repetitive TMS. RTMS involves the repeated delivery of magnetic pulses over time. It can be used to modulate brain activity and induce longer-lasting effects. Common RTMS protocols include high-frequency RTMS. It involves the application of a series of rapid pulses at a frequency of 5 to 20 Hz. High-frequency RTMS is often used to increase cortical excitability and enhance brain activity in the targeted area. Low-frequency RTMS. It involves the application of pulses at a frequency of 1 Hz or less. Low-frequency RTMS can have inhibitory effect on brain activity and is used to decrease cortical excitability. Theta burst stimulation. It is a patterned form of RTMS that delivers bursts of 3 pulses at 50 Hz in a rapid succession. Theta burst stimulation can be used to induce more rapid and efficient changes in brain activity compared to traditional RTMS protocols. Transcranial magnetic stimulation, TMS, has a wide range of applications in both research and clinical settings. Here are some notable applications of TMS. Treatment of depression. TMS has been approved by regulatory authorities, such as the U.S. Food and Drug Administration, for the treatment of major depressive disorder. In a procedure known as repetitive transcranial magnetic stimulation, RTMS, TMS is applied to the prefrontal cortex to modulate neural activity and elevate depressive symptoms. It is particularly useful for individuals who do not respond well to traditional antidepressant medications. Management of chronic pain. TMS has shown promise in managing chronic pain conditions such as fibromyalgia and neuropathic pain, by targeting specific brain areas involved in pain processing. TMS can modulate neural activity and provide pain relief. It is often used as an adjunctive therapy alongside other pain management approaches. Research in cognitive neuroscience. TMS is widely used in cognitive neuroscience research to investigate the causal relationship between brain regions and specific cognitive functions. By temporarily disrupting or enhancing neural activity in targeted brain area, researchers can assess the role of that area in tasks related to perception, attention, memory, language, and motor control. Mapping brain function and connectivity. TMS can be used to map functional connections between different brain regions. By stimulating one area and measuring the effects on distant areas, researchers can infer the strength and directionality of the neural connections. These techniques, known as TMS EEG or TMS fMRI, provides insights into brain networks and their dynamics. Stroke rehabilitation, TMS has been investigated as potential tool for stroke rehabilitation. By stimulating the unaffected hemisphere, TMS can promote cortical reorganization and facilitate motor recovery in individuals with stroke-induced motor impairments. It is often combined with physical therapy to enhance the rehabilitation process. Cognitive enhancement and learning. TMS has been investigated for its potential to enhance cognitive performance and facilitate learning. By modulating neural activity in specific brain areas, researchers have explored the effects of TMS on memory, attention, decision-making, and skill acquisition. However, the efficacy and long-lasting effects of cognitive enhancement through TMS are still areas of active research. It is important to note that while TMS has shown promise in various applications, it is an evolving field, and the specific protocols and applications may vary depending on the research or clinical context. TMS should be administered by trained professionals following established safety guidelines and protocols.